yet another episode of Cancer Talks with Dr. Rajiv Vijaykumar, more famously known as Tumor Taper Rajiv. Dr. Rajiv is a seasoned medical oncologist and a hematology specialist, ethical, cost-conscious leader in cancer care and BMT. Well, this month, October, is the Breast Cancer Awareness Month, and this episode with Dr. Rajiv Vijaykumar is particularly dedicated to the topic of breast cancer. We've been overwhelmed with all the questions that people are asking, and yes, this episode and this series is dedicated to all the frequently asked questions that people ask. We all know cancer is really something that's very shocking even today to most of the family members, and they have so many questions. So go ahead, ask your questions, leave it in the comment sections everywhere, and we will pick up. So doctor, I have plenty of questions that have come to us on WhatsApp, that's come to us on YouTube, that's come to us on social media, plenty of it.
Fantastic.
So
happy to talk.
Right, and I'm picking up those questions out to do with breast cancer because October is Breast Cancer Awareness Month. So
Correct. So I'm sure people would know that breast cancer is the most common cancer in women. Earlier it was cervical cancer, in the last 15 years it's become breast cancer, not just in India, but in the rest of the world as well. So it's very important that we talk about breast cancer. We talk about screening, we talk about mammographies, we talk about to detect that lump as soon as it is seen, to talk about self-test examination to ensure that ladies spend 5 minutes per week or 5 minutes per 15 days when they're having their bath to look up, look into the mirror, enjoy themselves, then afterwards clinically examine their breasts, examine their armpits to see if there are any nodules, etc. And then if there's anything amiss, any change in the size of the nipple, discoloration, if any of these things, then you need to go and meet your physician or your surgeon. Then they would help you out in detecting whether it is cancerous or a non-cancerous lump.
Doctor, the most common question that has been asked is, how can I get breast cancer? I don't have anybody in my family who has got it, and genetically I know my family. Nobody has breast cancer so far. Cancer may be one or two instances, but that too far relatives. So is it even possible that somebody like me could get breast cancer? This is one of the very common questions that people have asked, and these are women in their 30s and 40s who are asking this question.
Very true. So some people say, sir, ನಮಗೆ ವಂಶದಲ್ಲಿ ಯಾರಿಗೂ ಕ್ಯಾನ್ಸರ್ ಇಲ್ಲ. ಆಮೇಲೆ how big is your ವಂಶ, man? You're like Rajaraja Cholan or what? Where are you from? But then I'll be like, okay, mind voice. I'll not say tell the patient, but nevertheless, see what happens is 95% of cancers, breast cancers, are sporadic. Sporadic means it can occur suddenly. It can occur de novo. That person would be the first person in their family to develop a cancer. That is called sporadic. 5% of breast cancers are hereditary. That means out of 100 patients who are there, breast cancer, 95% would not have had any particular family member who has it. 5 people would have some known, like their mother or aunt, like Chikkamma, Dodamma, Masi, anyone who's had a breast or an ovarian cancer as well. So it starts with someone. So therefore, even if you developed a sporadic cancer that is no one else has had, it is important for you to get checked for certain genetic mutations like BRCA1 and 2, SMAD4, there are ATM gene, there are multitude of genes to identify whether there are any. It gives you an idea that whether there are certain other targets for which you can get some certain therapies. Andre, if you have these particular mutations, you have extra number of therapies by which you will respond to the cancer. And also, can it be passed on from one generation to the other? Does your sister, your child, your daughter, is she going to be susceptible to these cancers? You will get this information as well. So basically 5% are transmittable, but nevertheless, even if you belong to the 95%, you could be the first person to have started that trend in your family. As it's not a good trend to have, nevertheless.
Right. Doctor, there's also other questions where people are panicking, okay, because there's so much awareness about breast cancer that everybody in their 20s and 30s are panicking, and they're like, what do I do? What can I do to ensure that, I'm in the safe space? And they have all read about the stage 0, stage 1, and it is very good if they get. So they're like, I want to get myself diagnosed in stage 0 when there's nothing happening. So what exactly, one is the stage 0, and 2 for somebody who's out there and who's scared? Okay, what's the first thing they need to do?
So now it's very common. Even recently, just 2 months back, I got a young girl, 21-year-old girl, from a very conservative family, very conservative background. She came in with palpitations, sweating. I asked, hey, I think you come to the wrong doctor. I said, no, I saw one of your videos and I come to see you because of that. You know what, I got this particular small nodule over my breast and nipple, and she was filled with so much of fear, guilt, mixed emotions. So as then I calmed her down. Hey, take a chill pill, relax. Then gotten my nurse, Monica, my nurse at Richmond Road. She came over, we calmed her down. Then afterwards, then we examined her. All she had was a small blister over her breast, and she had spent 3 sleepless nights because of that. Why? Again, although I keep saying that we need to raise awareness, sometimes too much of information on social media can be very destroying as well, devastating as well. So it's important for us to know how much to consume, how much to take, and how much to leave. It's very, very essential. So in the West, I'll just give you a perspective to this. In the West, mammographies have been going on since the 1970s, 1980s, where annual mammograms. So then the United Nations Task Force said, you know what, you do mammography for every woman after the age of 40 every year. Then they came out with some other guidelines saying that you do it once every 2 years. Then we guys were like wondering in our medical school, should we do once a year or 2 years? If they say 12 months versus 13 months, it's okay. 12 and 24 months, both are completely poles apart. Then afterwards, they brought these huge mammography vans. They used to run it all around the country, identifying, we were mentioning stage 0, that is very, very minuscule. It's not even formed a particular size criteria. So to identify those, then came in the paranoia that lots of young women were getting themselves tested. And you know, US and UK is not like in India. In India, if you want to meet a doctor, just pick up a phone and then after you talk, and then it's there. Over there in US and UK, you can see Lord Venkatramana, but you can't see a doctor over there. So in that way, what happens is, a lot of these women were given some mammography report saying that, you know what, there is possible suspicious lump. They will take 3 weeks to get an FNAC, and then afterwards, 3 more weeks to get a true cut biopsy, a biopsy of that lesion, and probably 3 months to see their doctor. And with this 3 months of stress, it used to be humongous. Lots of them underwent lumpectomies when it was not needed. And this went up to the tune of somewhere close to 15 to 18%. So 15 to 18% of women in the US started ending up getting breast surgeries done, thinking that they have cancer, and finally it all turned out to be a small, benign or a non-cancerous lump in their breast. So then the US FDA and then the United Nations Task Force, they said that, hey, you know what, put a stall on this. And then for some time we realized that the mammography went off the guidelines, then again it came back when good sense prevailed, because mammography is definitely useful. So you are going to get checked after the age of 40, clinical examination on like I told, while having your bath once every 2 weeks, you need to do that, and subsequently once in a year get a mammography done. This will keep you in good stead and identify if there are any stage 0 breast cancers, if any.
Right. Doctor, so we know that people who are over 40 should do their mammogram every year. What about people who've been diagnosed with breast cancer? Okay, what should they do? How should they take it? Of course, there is shock for them and the family. Okay, but we have seen a lot of your own patients do so well with breast cancers. So I want you to talk about how life has not changed for a lot of your patients, even though they've had breast cancer, and some of them have come to you at a stage where we thought that it's advanced or progressed. Those kind of cases have also come to you. So can you tell us a little more about how you made them cope with having a very normal life? I've seen people come to you, take chemotherapy, go back to work, actually not even go back home and rest.
Correct.
Right? So how is that even possible?
I actually learned this from my patients. I'm talking way back in 2016-17, when I had come to Bangalore from Delhi after finishing my tenure at Army Hospital, Delhi. I was seeing this young lady, 35, 36, mother of a 12-year-old. She was the vice principal of a Montessori school. So she used to work, she had a nice 9 to 5 job, only 5 days a week. She had Saturdays off. Montessori, I guess, Saturday, Sundays off. So she used to come, take therapy on Friday afternoons, and then afterwards go back Saturday, Sunday rest. Monday to Friday, she would continue working as though nothing happened. She lost her hair, but she wore a wig. She did not want her friends to know. Then during this Pinkathon, the Pick Up the Pace event which we've had at Gleneagles Hospital, during one of those, she came and she gave a very illustrious, very motivational speech, and which spread all over social media. And then her friends saw and asked, "Hey, you had breast cancer. We never knew. When did this happen? How did this happen?" So why am I telling you this story? It's about mindset. There are two sets of people. One set of people will be like, okay, I have a cancer. It's just cancer, right? I'll handle it. You're there with me, doctor. You'll help me guide through this, right? I don't have to worry, right? Listen, doctor, I have a lot going on my plate right now. Help me get through this. I don't want it to affect my core of my body. Help me out. And then there's another set. Oh my God, I've developed cancer. Our whole life is shattered. What happened to my child? The first person also has those thoughts, but he or she has learned to control his or her thoughts. The second person is completely distraught. ಏನಾಗುತ್ತೆ ಅಂತ ಗೊತ್ತಾಗ್ತಿಲ್ಲ, ನಾನು ಫುಲ್ ಹಾಳಾಗೋಗ್ಬಿಟ್ಟೆ, ನಾನು ಪೂರಾ ಬರ್ಬಾದ್ ಹೋಗಿ. This is the thought process that they have. So it's very important that like the examples that you mentioned, they're all people who come with this first set of thought process. So what we do to get this in the second set of people into this first set, we have a very good counselor with us, Mrs. Sumulata Vasudev. She does a fantastic job at calming them down. And then a whole team, there's Nazia, there's Navina, all the front office staff, they calm down the patient saying that, hey, relax, chill, it's just cancer, it's nothing too big. If you just take the correct treatment, you'll be out of it in no time. And we have a full system of support services to help you get out of this and do well. So with this, we've been actually very consciously identifying patients who actually need this help. We not just counsel the patient, but we also counsel the family, because many times the surrounding matters. Not many times, always the surrounding matters. Many times it is the surrounding people who would actually try to shake up the patient. The patient would be strong, but the family would start wailing, crying. They would have complete lack of happiness in life, and then because of this, the patient also loses heart, breaks down, and then feels that she's not going to make it. So it's very important to not just counsel the patient, but to counsel her whole surrounding. So actually, most of my patients have become our ambassadors of cancer. They actually go and tell, I counsel them, say, you know what, you go tell 10 people that you've had this and you've done well. Only then you will be able to save other people's lives. You might have your own friend who's sitting there thinking it's a taboo and not coming out. And are you going to be happy if she comes to stage 4 and then won't you feel miserable that you could have probably spoken to her and she would have identified it at an earlier stage? Then the patients are like, wow, I never thought of it this way. This is a good way. So then afterwards, so I've had pastors, in the sense that Christian pastors' wives, who initially did not want to talk about it because they said that their trade would get lost, because supposed to be healers themselves, how can they get disease? But then they went on stage during their church sermons and told the whole public that they have had it, that they are taking treatment at a good institute, doing well, and they are healed well. And trust me, people who have been open about it, not trying to hide it, talking about it, they vent out their emotions, they vent out all their stresses, and they do very well.
Excellent, doctor. I think with that, we want to come to the end of this, because we have talked so much about breast cancer. I'm sure everybody knows now. So this is the Breast Cancer Awareness Month, that is October, and Pink Up the Pace has been something that Gleneagles Hospital has been doing for such a long time. The onco department here has been heading this for 6 years now, and you should see the crowd. Look at the amount of people who actually come and support the awareness of breast cancer. So 20th October, please be there at 6 a.m. at Balakrishna Rangamandira to be a part of this run. It's a marathon, it's a 5K marathon. Please be a part of it and let's all spread awareness. Thank you so much, Doctor. Thank you for giving us all this information. And I'm sure now we have more questions come in, and I'm sure Doctor is more than happy
to answer.
With that, we come to the end of this episode focusing on breast cancer. We know breast cancer can be scary. Actually, any cancer can be scary. But with Dr. Rajiv Vijay Kumar, the medical oncologist, or more famously known as the tumor tamer Rajiv, cancer doesn't have to be scary. So, ask away questions on anything to do with cancer, and we are here to answer them for you. You could just WhatsApp your questions to us on 9775301470. Thank you for watching.